I'm going to talk to you. The Town of Bridgewater is part of a larger group for their health insurance. They're part of the Mayflower Municipal Health Group. And so the town purchases their insurance along with 30 some odd other municipalities so that you get some bigger buying power and bigger scale. So Mayflower Municipal Health Group and the Town of Bridgewater offer HMOs and PPOs to their active employees. And I'm going to share my screen to go over the HMO that's offered to you. So let's see, hopefully I can do this properly. Hang on. So Kimberly, it says you disabled participant screen sharing.
Let me just.
Okay.
I need to make you a co-host. Technical difficulties. Let me.
Okay. So I'll just talk while she's doing that. So the HMO option that is available to the Town of Bridgewater active employees, so those are people that are currently still working, or it could maybe even be retired but not yet Medicare eligible. So 55, 56 if you're a retired teacher. As long as you do not have Medicare, the HMO that is available to you is called Network Blue New England. It is an HMO plan. So when you have an HMO, you have a primary care physician. That primary care physician is really the doctor that you go to for your routine physical, for a sore throat, headache, general things, anybody you would see a general practitioner for. And then if you did need to see a specialist with an HMO, and this is in general with all HMOs, you would get a referral from your primary care physician to see a specialist that was within the network. So the Network Blue New England network is all of New England. So the all the New England states, they all have a Blue Cross and Blue Shield. So all of those Blue Cross and Blue Shield HMO providers that are in their state's network are available for you to see. So for instance, if you have a child that goes to college in Vermont, that child can see a primary care physician or a specialist in the Vermont Blue Cross and Blue Shield network. So it's a New England network. You're always covered for emergencies anywhere in the world. So regardless of where you happen to be, if you're in France, if you're in Paris and you trip on a step in the Eiffel Tower, we'll cover you in France. Anything that's an emergency is covered worldwide. But in general, for services in an HMO, you need to be in the service area, and the service area is New England. So should I try and share my screen again?
Share your screen now.
Okay. Great. So this is a summary of benefits for the Network Blue New England plan. So this plan, as I mentioned, is a HMO. So you have a primary care physician and you get referrals and you work throughout the network for your providers, although you would be covered anywhere in the world for emergencies. So you can see here that it says there's a $300 deductible. So we're going to walk through this plan. This plan does have a deductible, but the deductible does not apply to everything on in the plan. So it's just certain items. So we're going to go through it just to point out the highlights of it. So the second page of the summary of benefits talks, so we already spoke a little bit about it, talks about your primary care physician, the referrals, your cost share would be your co-payments or your deductibles, and we'll go through that. There are split co-payments for hospitals, so we're going to also talk about that. These are the higher cost hospitals here listed on the left-hand column. It talks about what your deductible is, your out-of-pocket maximum, which we'll also speak about, the emergency services, telehealth, the service area, and what is covered outside of the service area, and your dependent benefits. So this inner side, and this is available to you through the town. Also, it's on the Mayflower Municipal Health Group website, but this is basically what we would give you if we were at a health fair. So you'll see that not everything does have a deductible applied to it. So all preventive services, so these are the routine things like your routine physicals, child care visits, hearing exams, eye exams, those do not take a deductible, and actually they don't even take a co-payment, and that's because of the Affordable Care Act. So anything that is routine in nature does not take a copay and does not take a deductible. For outpatient care, can you guys see my cursor, or is that not there? No. So, okay, I just want to know if I was pointing, if you could see it. So for outpatient care, the emergency room is a $100 copayment after your deductible. So the deductible is $300 per individual, not to exceed $900 per family. So if you're an individual person, your deductible is $300. If you're a family of 5, your deductible is $300 per person, but it would never exceed $900 per family. Does that make sense to everybody? So it's a $300 individual deductible, a $900 family deductible, but once your entire family hits $900, you're done. No one, you're never going to pay more than $900 in that plan year. So for the emergency room, it's a $100 copayment after you've paid your deductible. So we'll use an example that on July 2nd, you fall down and you break your leg. You go to the emergency room. The emergency room puts a cast on it and sends you home. Because it's a new plan year, your deductible would be $300 for that emergency room visit plus your $100 copayment. So that broken leg would cost you $400. Once you've met your deductible for the plan year, you're done for the rest of the year. So you break your leg again in September now, and you go to the emergency room and you put another cast on your leg, it's a $100 copayment. There is no more deductible because you've met that. So whenever you go to the doctor, when it's not routine, so without your routine physical, not your routine eye exam or hearing exam, you have a $20 copayment for your primary care physicians. So that sort of general care level is a $20 copayment. All specialists would be $60. There's no deductible, it's just a copayment. So you can see that on this summary of benefits, it says no deductible. So that means it's just a flat copayment. So primary care visits, $20, specialists are $60. Behavioral health providers are also $20 per visit, no deductible. There is a telehealth benefit through, it's called Well Connection. It allows you to call a video chat actually with providers in an entirely different network of providers. They're called the Amwell network of providers. They're available in all 50 states. So if you're in Alaska and you need to see a doctor, it's not an emergency, maybe you have a sore throat or an earache or a funny little rash, you do have the ability to use a telehealth benefit, which we're learning now is a great thing to have. Chiropractors are covered also at $20. There's an acupuncture benefit up to 12 visits per year. That's a specialist copayment. Short-term rehab are things like physical and occupational therapy. That's $20 per visit. Speech, hearing, and language is also $20. When you get to CAT scans, MRIs, PET scans, and nuclear cardiac imaging tests, those are what we call high-tech radiology, and that's $100 copayment per category per service date after the deductible. So any high-tech radiology, so those are CAT scans, MRIs, PET scans, nuclear cardiac imaging, those all have a $100 copayment after deductible. Home health care and hospice services are covered in full with no deductible. Same with oxygen, durable medical equipment. Those are things like crutches and canes and wheelchairs. So it's like hardware items that has a 20% co-insurance after the deductible. So co-insurance means if it's, let's say you've met your deductible, if the bill is $100, you're responsible for 20%, so $20 of that. Same with prosthetic devices. Surgery and related anesthesia, if you have it done in a doctor's office, your primary's office, it's $20, no deductible. In the specialist, it's $60. If you have an outpatient surgery in an outpatient setting, it's $250 per admission after the deductible. The hospital inpatient services, this is where I'm going to refer you back to that second page of the summary of benefits. There was a list of higher cost hospitals. In general, most hospitals have a $500 copayment per admission after the deductible. But that list of providers, that list of hospitals, and I'll go back in a minute and we can look at it again. If you're admitted to any of the higher cost share hospitals, that copayment would be $1,500 per admission. rehab and skilled nursings have no co-payments after deductible. So let's just go right back up to that for a second. So here are the high-cost hospitals: Bay State Medical, Boston Children's, Brigham and Women, Cape Cod, Dana-Farber, Fairview, Mass General, and UMass Medical Center. So those are the hospitals that would take the higher co-payment. I do want to just take 1 second. Here's the part that talks about telehealth, which is good for you to know. But I do want to talk about this maximum out of pocket for a second, this block that says your out-of-pocket maximum. So all those co-payments we talked about, especially the hospital ones, and your deductible, it seems like it's a big co-payment. It seems like it's a lot of money, and it is, but you're protected. So there's something called the out-of-pocket maximum, and that means that all of your co-payments and all of your deductibles and all of your co-insurances for your plan year, so that's July through June, we keep track of all of those. And once you have hit your out-of-pocket medical benefit, which is $2,000 per member or $4,000 per family, or your prescription out-of-pocket benefit of $3,000 or $6,000, everything after that in that plan year is covered at 100%. So that cap is to protect you. It's not to say that's all the benefits we're providing. It's to say that you're out of pocket when you're actually paying for these services in your copays, your deductibles, or your co-insurances. We're going to cap that. This is what Mayflower decided to cap it at. $2,000 per member for medical, $4,000 per family for medical, and for pharmacy, it's $3,000 or $6,000. So I'm just going to catch us back up to where we were before. We're almost done. So this is the hospital. Again, the lower tier are $500. That's the majority of the hospitals after deductible. Those hospitals we just quickly listed, those would be $1,500 per admission after deductible. And the last benefit I'd like to talk about, then we can open it up for questions, I think, is the pharmacy benefit. So it's on a 3-tier basis. Generic is tier 1, brand is tier 2, most, and then there's some expensive brand names on tier 3. So actually it's most generics are tier 1, most brand names are tier 2, and the expensive brand names are tier 3. So if you go to the drugstore and you want to get a 30-day supply, let's say you need an antibiotic or you have poison ivy, you need some sort of steroid, something like that, you need a very short-term prescription, you go to the pharmacy, you're going to pay either $10 or $30 or $65 for that 30-day supply. Many people take maintenance medications. Maintenance medications are things like high blood pressure medication or cholesterol medication, or maybe it's an eye drop, something that they're going to use on a day-to-day basis where the prescription doesn't change. You know, you're taking it for the long term. So you can use the mail service for that, and the mail service has a 90-day supply that will be sent to you. So you can get a 90-day supply of that generic or most generics for $25. The brands at $75, and the non-preferred brands at $165. If you take what we call a specialty drug, and those are very few people take them, but they're very delicate prescriptions, you may need to use a specialty pharmacy network, which is built into our plan. So if you're taking an MS drug, a rheumatoid arthritis prescription, some sort of home-infused chemotherapy medication, you may not be able to fill it at a local drugstore because they don't stock it because it's too delicate of a drug. So there's other special pharmacies that you would use for that. On top of that, if you want to join a fitness program, we'll reimburse up to $300 per calendar year for that. And there's a weight loss program also available for, and we'll reimburse up to $150 for that. And those are calendar years. So I'm just going to quickly go over a quick overview. The plan is called Network Blue New England, $300 deductible. There's a $300 per member deductible, but not to exceed $900 per family. All routine things are covered with a $0 copayment, no deductible. That's part of the Affordable Care Act. If you go to the emergency room, it's a $100 copayment after you've met your deductible. Office visits are $20 with your primary, $60 with a specialist. If you need high-tech radiology, it's a $100 copayment after your deductible. Outpatient surgery is $250 in an outpatient facility after the deductible inpatient would be $500 or $1,500 after the deductible. And drugs have no deductible, and it would be 10 or 30 or 65 at the retail and 25, 75 or 165 through the mail. That was a lot of talking. So do you want to open it up for questions?
Great. I think this would be a great time to open it up. On your screen for the participants, you should see a green button that says yes. If you'd like to ask a question, you can click that button and I can unmute your mic. So you can ask Tanya your questions, or you can send us the question through the chat feature. So I invite you now to please ask your questions, because the vendor is the best person to for you to ask questions about the plan.
Yeah, and actually, if I could just jump in, if you have something personal that you do not want to talk to everybody, and especially because this is being recorded, you can pass your information over to Jessica and Kimberly, and I can call you offline. I fully recognize that this is, general questions are fine, but you may not want to share your information with the group.
Absolutely. Any questions?
Yeah, Kimberly, it's Shelley. I have a question.
Yes, please go ahead.
And I'm not sure if it is through Blue Cross Blue Shield, but I remember a year or two ago I had to have a CAT scan done. And is it through Blue Cross Blue Shield if you I don't know what it's called, you ask around or you...
Oh, Smart Shopper.
Give you $100 back?
Yeah, that's great. Yep, Shelley, that's true. So there is a Smart Shopper as part of the Mayflower offering. If you shop and you're able to have your services done at a facility that's less expensive, because it's remarkable how different the prices can be depending on the different places you can go to. So if you shop and you're able to have that service done somewhere else that's cost less, you're rewarded financially. So I would suggest that everybody who's interested in that look at the Mayflower website. So there's definitely information on that.
Yes, that's it. Smart Shopper.
Yeah.
Thank you.
Yeah, thank you.
Great. Jennifer, you have a question?
Yes, thank you. I just had a question about the high-cost hospitals that you listed.
Yep.
Are they all of the UMass hospitals in the UMass system, or just UMass Memorial?
It's just UMass Memorial Medical Center.
Okay, thank you.
Yeah.
Great. Are there other questions? I don't see any in the chat or here. So thank you for the...
Yeah, I just want to reiterate, I'm sorry. I just want to reiterate that if you have a personal question, just pass your information along and I'm happy to call you.
Perfect. So I'd like to thank everybody for joining us today. I'd just like to give you...
Sorry, one more thing, Kim.
Yes, Shelley.
Are the new rates going to be given to us, or?
The new rates... The new rates were sent out.
Oh, they were?
All employees in the employee newsletter. We sent it out again yesterday.
Okay, I'll look. Thank you.
Yep, and they're also available on our website. We have a new human resources webpage, so feel free to check that site out for any information. I'm going to share with you all quickly before I let you go my screen. Let's see if I can do this well. Share. Hopefully you can see my screen. So I just wanted to share some information about, we have Jessica's joined us as our HR generalist, and she's going to be helping us with doing some of the administrative work for open enrollment. So if you have some questions, feel free to reach out at hr@bridgewaterma.org. Please call our HR number, which is 508-697-0791, or our temporary cell number, which is 774-380-0073. That information has been sent to all employees and retirees through your newsletter. So the same information is something, but it gives you an idea of who you need to contact. So if it's about the open enrollment period, which we have started as of today, you want to send that over to HR. But if there are particular plan questions and ID cards and claims, that is information that you'd go directly to the vendor for. Just reminding everyone, open enrollment is today. It ends on May 15th. Open enrollment is the only time that you can make changes to your benefit plans unless you have a qualifying event. And for us, no enrollment forms will be accepted after May 15th. So if you have any questions, please feel free to reach out to us, myself or Jessica. We are happy to help you. So hopefully.
Thank you.
So with that, I want to thank you all again, and thank you so much, Tanya, for joining us today. We really appreciate it. And I'd like to thank all the employees and the retirees that have joined us today. This session will be placed on our website so you can view it at a later time. And with that, I'll conclude today's session and ask you to join us for our next. Thanks, everyone.
Thank you.